Ayurvedic properties. First of all, they lost Nepalese people.
Sorry, ma'am, you're just going to go live. Just please. Wait, sorry.
Okay.
Just sorry.
Fine.
I mean,
So,
the
Irina, we are going live. We're just starting the program. If it's okay, if I can just take over.
Yes.
Okay. Thank you. So, good afternoon or good evening, depending on which part of the world you are in. Welcome to this session on the future of Ayurveda tourism. We're delighted to have Ms. Rupinder Brar, Additional Director General, Ministry of Tourism, Government of India. Dr. Manoj Nesari, Advisor, Ayurveda, Ministry of Ayush. Dr. Jyotsna Suri, Past President, FICCI and Chairperson, FICCI Travel, Tourism and Hospitality Committee, and also the Chairperson and Managing Director of the Lalit Suri Hospitality Group. Mr. Sanjeev Kurup, Chairman, FICCI Ayurveda Tourism Subcommittee and the Managing Director, Ayurveda Mana Hospitals. Mr. Abhilash K. Ramesh, Executive Director, Kairali Ayurvedic Group. Mr. Manu Rishi Gupta, Chief Executive Officer, Niramaya Wellness Retreats. Mr. S. Swaminathan, Managing Director, Dravidian Trails. Ms. Irina Gurieva, top Ayurveda travel company from Ukraine. Mr. Shubham Agnihotri, CEO, LS Vishnu Limited from Taiwan. To each one of you, and ladies and gentlemen, good evening and a very warm welcome. We are extremely delighted to welcome Ms. Rupinder Brar, Additional Director General, Ministry of Tourism, Government of India. Thank you for joining us from Srinagar. I don't know what the temperature there is, but anyway, thank you for taking time out, and under your leadership and with the other partners in the Ministry of Tourism, you've taken several initiatives in the past year, including Dekho Apna Desh, to increase awareness of the rich tourism potential that India has to offer. We look forward to your valuable insights and views and taking Ayurveda tourism to the next level. It's also an extreme pleasure and a delight to have Dr. Manoj Nesari, Advisor, Ayurveda, Ministry of Ayush, Government of India. Thank you for joining us in the pandemic. The Ministry of Ayush has taken a huge set of initiatives to popularize Ayurveda and help and position Indian industry globally. We were pretty shocked to hear of the unfortunate incident with the minister. We wish him a speedy recovery. I would like to thank Dr. Suri for her leadership and the vision for the FICCI Travel, Tourism and Hospitality Committee. A very warm welcome to our own Mr. Sanjeev Kurup for leading the FICCI Ayurveda Tourism Subcommittee and putting this webinar together. As you would have picked up from the conversation prior to the start of this program, he is well known and has a lot of friends across India and the world, but more importantly, he's been leading a relentless effort to open up Ayurveda centers in India and actually make it safe and enjoyable for those of us who want to actually visit these centers. Ayurveda tourism has played a key role pre-COVID and even more so during COVID times. There is a new generation in the domestic market that are now looking for Ayurveda for healing and wellness, and therefore a huge opportunity for India to promote Ayurveda tourism that will definitely see an increasing demand from both domestic and international markets. FICCI has promoted medical wellness travel for several years, and I believe now we should, recognizing the importance of Ayurveda in the global scenario, we've initiated a strong focus for Ayurveda tourism. I don't want to take up more of your time, but just saying that the central and state governments, the Ministry of Ayush, Ministry of Tourism, and we've been recommending that we facilitate the inclusion of Ayurveda tourism under medical visas. This will increase the arrival of foreign tourists who are seeking Ayurveda treatment for longer durations. There are many more recommendations, but this is not the time to go into that. But I would now request Dr. Jyotsna Suri, Past President FICCI, and Chairperson FICCI Travel, Tourism and Hospitality Committee, and Chairperson and Managing Director of the Lalit Suri Hospitality Group, to kindly give the opening address. Dr. Suri.
Thank you very much, Dilip. Rupinder ji, Dr. Manoj Nesari ji, my colleagues from FICCI, Eminent panelists, namaskar, and a very warm welcome. From FICCI, we've been working very hard. I mean, through this pandemic, starting all the way back in March, we've been really working very hard to see how we can actually do something to revive or make this industry survive. Keeping that in mind, at my level, I've created some subcommittees, and Ayurveda subcommittee is one of them. So the concept behind that was or is that we start putting more focus on different verticals of tourism, so that we can be repeatedly heard and seen, and we can spread the word around within India as well as internationally that India is ready for tourism. So keeping that in mind, we have, of course, a very, very capable Mr. Sajeev Kurup heading the Ayurveda subcommittee. As Dilip has said, he is very well known, and he knows exactly how and when we should put the push on promoting Ayurveda tourism. Yes, wellness has been something that is that's something that we learned during this pandemic. Typically, Ayurveda was very, very popular with the foreign tourists, and we had a lot of international tourists who would come in, and the positive side was that they would come in for a longer duration, because that's what it's all about. You can't come in for a wellness session for 2 days or 3 days. Unfortunately, because of the pandemic, we have not been able to get any of our international tourists. However, the domestic push is what we've been doing. And in any case, a country as large as India has to have a very strong domestic tourism. We welcome all the foreign tourists, but we do need to have a very strong domestic tourism. And that's what FICCI has been promoting for a long time, not only now, but even earlier. Rupinderji also has been very, very supportive of the push for domestic tourism. And it's really nice to know that now the Indians are beginning to understand the value of Ayurveda. It just sometimes happens that your own people don't appreciate what you have. And that's what has happened with Ayurveda within India, where we have this rich heritage, and it goes back thousands of years, but never ever taken it seriously enough. Now I believe, and I'm certain about that the generation that is coming in has understood the value of what Ayurveda can do for us, and therefore the wellness aspect is beginning to take a different precedence in the lives of tourists. So it's not just going and having a fun holiday, but if you can go and spend a certain amount of time for the body, mind, and soul, which is what we actually do with Ayurveda, people are beginning to recognize that. So I thank all of you for being in here today. This is going to be a special interaction, and we would love to hear from both Rupinderji as well as Dr. Manoj Nesri about what their plans and what their thoughts are about promoting this element of tourism, which I believe has a huge future. Most of the people in north of the Deccan Plateau are not giving enough attention to Ayurveda, and I believe that's where we should go. So thank you all so much for coming in. I'm handing it over to you, Sajeev, to take the panel forward.
Good evening, all. Namaskar. I'm straight away coming, just saying thanks to Dr. Jyotsna Suri and Dilipji and the entire FICCI team to organize this webinar on the future of Ayurveda. It's very important, I'm now just telling it as it's not post-COVID, it is post-COVID vaccine scenario. That's the word we'll have to use. So the first meeting of this kind is happening after the 17th, the epic day when we started giving vaccines, and that may give enlightenment for the people to travel right across the borders and international travel. So I'm so happy to see two senior government officials from the two departments, like the tourism department represented by Madam Rupendra Brar and Ayush Ministry represented by Dr. Manoj Nesri. You know, it is something, the two important sectors where we'll have to work together in the future and the coming days of the post-COVID vaccine scenario. So I'm just going a little bit points to be taken before introducing the panelists and the main speakers. Just give me 2 minutes. Madam Rupendra Brar, no, we, the FICCI committee, I represent the FICCI subcommittee on Ayurveda Tourism Task Force, and we are so happy for your support. And we met on the first day of you assuming the office in Delhi, I think by during September or August 2020. Someone introduced me to you so that, you know, we can work together for the future. I think, you know, that will continue, your support and everything will continue in the future. FICCI National Committee has asked Ayurveda Tourism Task Force to give a couple of points, only specifically 3 points, to put it before the Tourism Department, Government of India. Madam, the main problem now all of us are facing is the different interstate travel regulations imposed by different states. So we want to rationalize the interstate movement rules without any quarantine controls and COVID test 19 certificates, because people are afraid to take COVID test certificates and they fear to travel across the borders because of the quarantine rules. The protocols for the COVID-19 can be decided by the states. It's totally a state subject. So rationalize the movement, because majority of the places, you know, it's open up. In Kerala, the thing is that, you know, 7 days people are allowed to come as tourists. On the 8th day, he want to continue, he will have to undergo a test. So they will go back after 5 days. And Ayurveda, you know, it requires minimum 11, 14, 21 days, and we don't require people to come for 7 days. So you'll have to have a look in that particular thing. And also we can understand the issues of the emergence of the new wave in the different European countries. So at least medical visa, people who are interested to come for Ayurveda, you know, they used to come regularly every year. They used to do like a vehicle service, you know, they used to do the rejuvenation program there for their body. So such people who are interested to come to do the Ayurveda programs, you know, should be allowed to get the medical visa. You do one thing, don't give them an open tourism visa. You give a specific, you know, request base where they are going to be. A confirmed norms, you can do it. That also we have given. And also the Indian overseas embassies will have to give a note that I know, I am sure that, you know, it's External Affairs Ministries and other ministries, but always tourism department can help to issue the medical visas. Once medical visa, because, you know, the next season is only going to have in September. So if you are not getting people by March, then that season is gone. So you'll have to look into these 3 points. You know, Manish and Jyotsna ji will take it forward to you. These are our recommendation for the tourism department. And the most important one is Dr. Manoj Nesri ji. Welcome. First time we are meeting. I am Sajeev Kurup, Ayurveda Promotion Society of Kerala. I am the president for that, and also National Level FICCI Tourism Advisory Committee. Manoj, it's very relevant that, you know, the central government policies on introducing the insurance mediclaim policy for Ayurveda tourists. Ayurveda, very welcome stand. We are thankful for Modi ji and the government of India to open the medical reimbursement facility for the Ayurveda clients. I'm not telling it's an Ayurveda wellness clients, it's Ayurveda clients who actually look for the treatments. Unfortunate thing, you know, you are aware, since you being a doctor, you are fully aware of the NABH, what you call the terms and conditions for the certification of Ayurveda centers. The small, the medium sectors, which place around 60% of the Ayurveda centers in India, are they're finding it very difficult to get the NABH accreditation, because the norms and regulations which the NABH is following is to like a 500-bedded allopathy hospital and a 20-bedded Ayurveda hospital. The norms and procedures are same. So we want to see that, you know, a rationale is to be established for small and medium sector, wherein I'm not telling that, you know, you'll have to make it everything easy and free. You'll have to go for a standardization of quality, because after the flights opening up, you know, you may have to get a rush of people, and almost all the places are going to get more and more clients. So NABH accreditation for small and medium sector in Ayurveda clinics, hospitals and resorts. That point to be taken very seriously. And already we have submitted a couple of representation to minister, and I think it is under the follow-up of, anyway, since you are already come and facing us in this webinar, we will put it across to you again to the representation for liberalizing the policy of NABH norms and regulations for small and medium Ayurveda hospitals, so that in the long run, all the hospitals and resorts in India should be recognized by NABH, so that the same quality procedure can be followed. So I will be giving a separate representation on behalf of the FICCI Tourism, Ayurveda Tourism Task Force to you on that. And I think since you being a doctor, you're fully aware of the small and medium players. There are difficulty in getting a consultant to get the NABH accreditation and all. So we will have to get, once everything is through, like the Modi ji's commitment on yoga, how he has made it, Ayurveda wellness, if we all work together, I'm 100% sure that, we will set India as a top destination for Ayurveda and wellness tourism in the coming future. Thank you for taking this time. This is something which, since you two people are here, I just want to address that important issue, so that, my people are watching from different regions of Ayurveda sector. Emphasize me to take these 2 points into the attention of both of you. I'm 100% sure that, Manojji and Ravindra Bharji take it as a positive thing. And we were all suffering for the last 10 months like all other sectors. And if the movement is not made easy, then our life is going to be in a miserable level. So I'm requesting once again, and now I'm coming straight into the business. May I welcome Manoj Nesri, the advisor Ayurveda, Department of Ayush, Ministry of Health and Family Welfare, Government of India. I just give a small briefing for our webinar attendees. Dr. Manoj Nesri is an Ayurveda doctor by profession. He has done his BAMS from R.A. Poddar Ayurveda College, Mumbai in 1987. Then he has done his Ayurveda from IPGTR, Gujarat Ayurveda University. And his contribution towards the development of Ayush sector has been varied, such as the policy and planning for matters pertaining to Ayurveda education, practices and research, capacity building of stakeholders, development of new courses, regulations, research plans, various schemes for promoting different sectors in Ayush. He has represented the Department of Ayush in various committees, meetings, discussion and negotiation with the different ministries of Government of India and national as well as international regulatory authorities and organizations. He has also participated in numerous seminars and conferences as initiated faculty and has derived many lectures in medical and science universities in India and abroad. He is the right person, and we welcome Dr. Manoj Nesri ji to address this webinar. You're welcome.
Thank you, Sanjeev ji. I hope I am audible.
Yes, sir. Yes, sir, you're audible.
Yeah, thank you. So, Rupendra Bharji, Dr. Jyotsna Suri, Dilip Chinoy, Abhilash, Irina Guriva, Praveen Mittal, and all other colleagues and the participants. I am really thankful for this FICCI to organize this interaction with all the stakeholders. And this is a very important subject, this medical tourism, especially the Ayush and Ayurveda-based medical tourism, which is badly affected by this COVID. And at the same time, it has tremendous potential in contributing to India's economy as well. And I will start with the Prime Minister's quote, what actually he mentioned during the latest Ayurveda Day, which was celebrated in this November, and in which the Prime Minister, he a second time said that the last few years, they were actually dominated by the IT sector, and now the coming years, they will be dominated by the Ayurveda. So these are his statements, and it is not only the statement, but the Prime Minister as well as the entire government is working on these lines. And while working on these lines, the Ayurveda has been promoted proactively, and it is both in the products as well as the services. Because if you could notice the change, that a few years back there was more focus on the products of Ayurveda, but now it is the products as well as the services. And accordingly, the Ministry of Ayush is also working on both the lines for the products as well as the services. And when we are talking about the services, it is both, that is the wellness part of it, the promotion of health, as well as for the diseases. I would just like to give some brief about the activities undertaken by the Ministry of Ayush and the recent pandemic of COVID, because India and the Ministry of Ayush, we are the first to emphasize mainly on improving the immunity of the people to fight with the COVID. And a massive campaign was launched, not only countrywide, but I would say that globally, because in this, all the Indian embassies, the Ministry of External Affairs, they also support the Ministry of Ayush, and the advisory which was developed by the Ministry of Ayush, and the research which has been done by the Minister of Ayush. So this has been translated into all these 8 different foreign languages, including the Russian, Chinese, Japanese, German, Spanish, Arabic. All these languages, it is being translated, and it is being conveyed to all the various countries. The information is being disseminated, and because of that, many and many more countries and many more people, they are getting aware of the activities which are done by the Ministry of Ayush. And in that, not only the advisory which was issued by the Ministry of Ayush, but probably India is the first country and the only country where the Ayurveda, that is the traditional system of medicine, it has been notified as the essential services. So this Ayurveda is now the part of the essential services, and because of the essential services, the Ayurveda industry, so that could remain functioning even during the lockdown. And because of that, the Ayurvedic medicines, so they could be made available to the public. At the same time, the media and the state governments, they promoted this various advisory and the guidelines and the various activities which are to be undertaken by the people. And because of that, despite the huge population and the dense population in many cities, the overall percentage of the people, those who are affected by COVID, and the morbidity and the mortality rate, so compared to many other countries in the world, it is very, very low. And we have also done the survey through a mobile app, or in which almost 200 million people, so they actually responded to that. And 90% of the people, they responded that they are consuming this various Ayush Kwath and the Chyawanprash and other things, and they have benefited with that. So this is a massive study. This is a big data. So likewise, we also conducted a well-planned study on 80,000 Delhi police, in which the Ayurvedic medicines, they were given to all the Delhi police. And there actually we could see that on one hand, the incidence of COVID was on alarmingly rising in Delhi population, whereas the Delhi police, who were the frontline workers, so there actually it went down from 3-digit every day to single-digit every day. So likewise, there are a number of other studies, the scientific studies as well as the international studies, which have been undertaken by the Minister of Ayush. And now we are in the process of developing the intercontinental clinical trial as well. So in nutshell, 112 different clinical trials have been undertaken by the Ministry of Ayush in this COVID. And in this COVID, Ayurveda has actually emerged in its true strength, that Ayurveda is a serious medicine, and Ayurveda can work better in the pandemics like COVID, where the people, those suffering with the COVID, they can be cured within 2 to 3 days, and they can become COVID negative within 7 to 10 days. And this actually has been recorded in the All India Institute of Ayurveda, which was a COVID hospital in which all these COVID patients, they were getting admitted. And this is as against the conventional treatment, wherein the patient, they used to take around 25 days to become COVID negative. So this is a significant change actually in the approach that the government has shown, that in the pandemic of COVID, with the Ayurveda, it is possible that the patient, they become symptomless within 3 days. they become COVID negative within 7 to 10 days, as against it takes almost 25 days in the conventional medicine. So this is the biggest advantage, and with that, the Ministry of Ayush, it issued the letters to all the teaching institutions to start the fever clinic. So this is on one side of the pandemic, what the ministry has done. At the same time, there are many other initiatives taken by the ministry, whether in terms of the tropically neglected diseases, or whether it is pertaining to the non-communicable diseases, whether they are pertaining to the diseases related to age old. At the same time, for the medical tourism, the ministry is promoting the export of services. And as I mentioned, so this is in line with the national health policy, where we are promoting the health and wellness part as well as the disease part. And there are many hospitals which are coming forward with the specific specialty. So whether they are having the neurology kind of diseases, whether they are having skin conditions, and many foreigners, they are coming for this various these kind of elements to India to get a treatment. And not only in the foreigners, but even the domestic people. So now they are becoming more and more aware of the strengths of Ayurveda, and the domestic people, now they have started taking the treatment, getting admitted to various hospitals. Unfortunately, the infrastructure on the east side of the India, so it is not so strong compared to the south and the west. And the ministry is now coming up with a new scheme called as the medical value tourism, wherein the ministry would like to promote the private sector to establish the hospitals in the greenfield, so that we can have a robust infrastructure which would be accredited. They will have accreditation from the NABH or such kind of other accreditation agencies, to ensure that the quality of services as well as the infrastructure which is being provided in these hospitals, it will be as per the international standards. Regarding this NABH, we understand this, there were difficulties. These difficulties which are being faced by the Ayurveda daycare centers and the hospitals. So we have always taken with the NABH. Today morning itself, I had one meeting with the NABH, and NABH is proactive. And we have today, in fact, morning itself, we decided that we can have a series of meetings with the various stakeholders, with the hospital associations and the Ayurveda practitioners associations, to understand your difficulties and how actually we can come out with the modified guidelines, which will be of international standard. At the same time, they will be the more practical for the purpose of implementing at the ground level. So these are the various initiatives that we have taken with the NABH. As you know, the anyway standards for the wellness centers. So we came out with those standards in the year 2009 and 10, and now there onwards there is a lot of development into it. As you just now mentioned, we are also engaged with the various insurance agencies, and more insurance agencies, they are coming forward, and they have made available this insurance package to the Ayurveda sector as well. At the same time, at the international level, the ministry has signed MOU with 33 countries, and more and more we are actually into negotiations. And it is not only the countries, but at the same time with the multilateral the forums like the ASEAN and the BIMSTEC, as well as the G20 or the BRICS. So the ministry is engaged into negotiations with these multilateral forums, and where actually the some of the forums, so they have agreed to establish a separate working group on the traditional medicine, so that the say for example the SCO, because SCO is the largest group, and the SCO group has agreed to the ministry's proposal, and this was strongly supported by the Prime Minister as well as the Minister of External Affairs. And because of that, the SCO countries now they have agreed to establish a working group on the traditional medicine. So these kind of initiatives, they will give a further boost to the Indian economy, and not only to the Indian economy, but especially to the Ayurveda sector in promoting this Ayurveda medical and wellness tourism. At the same time, there are many other forums, say for example, the Mekong Ganga Cooperation. In Mekong Ganga Cooperation, there's Cambodia and Vietnam. So all these countries, they are the part of the Mekong Ganga. So initially, some few years back, there was an approach only towards the West, whether we were targeting to either US or to the European countries. but now it is almost the pan world. It is the efforts are there. So the SEO countries are there, the Eastern countries, they are there, and the ministry has established collaboration. We also conducted studies where actually the Ayurveda is recognized. As you might know that the African countries are the countries where Ayurveda is recognized formally as a system of medicine, and there is great potential in African countries. I request all the stakeholders, those who are present here, as well as those who are not, but those who would be interested, to have this dialogue with South Africa and Tanzania and Ghana and Zimbabwe and many more countries where Ayurveda is formally recognized. Let us actually establish a more strong collaboration with these countries so that we can also have more robust exchange of the thoughts as well as the business with these countries. The latest entry into this is the Cuba. In the last year, in the beginning, the Cuban government got very much interested into Ayurveda, and now Ayurveda is recognized in Cuba. As you might know that Ayurveda has also been recognized to a certain extent in Brazil, because Brazil has included Ayurveda in the national policy of the Brazil. And now it is in the development of having the formal recognition to the Ayurvedic medicines as well. There are many more practitioners and the schools in Brazil. So likewise in entire Latin America, there is it is totally vibrant as far as the Ayurveda is concerned. So there are a lot many opportunities are there. At the same time, we have to also ensure that the not only the hospitals, but at the same time the skilled manpower. So we should have the skilled manpower, because as you know that in Ayurveda, especially if we are talking about Panchakarma, so it is not only the Panchakarma Vaidya, but the service providers, that is the Panchakarma therapists and masseurs, they should be absolutely skilled. And for that we are also working with the skill council, and with the skill council there is a health sub council for the Ayush. They have developed 6 different programs to be launched, and from this academic year we'll be launching this skill development programs, and we are targeting that 100,000 minimum such skilled professionals. They will be there, whether they are the therapists, whether they are the Panchakarma masseurs, whether they are the Prakriti analysts. So these kind of workforce that should be that is very much required, whether they are the Marma therapists, because we know that the Bishak Dravan Upastata Rogi Pada Chatushtayam, that means not only the doctor, but at the same time, the Upasthata, that is the supporting staff, is also important. So the ministry has also focused with this, and with this, the entire structure of the drugs, the services, the infrastructure, and the doctors. So the quality of all this, they will be ensured. At the same time, we are also in collaboration with the MSME. You might have received the communication from the MSME and the various the programs of the MSME. Now they are available to the Ayurveda industry as well. And when we say Ayurveda industry, it is not only the drug manufacturing industry, but it is also the service industry. We also conducted 3 programs with the Service Export Promotion Council, one in Bangalore, one in Chennai, one in Mumbai, for the promotion of the export of services. So likewise, the initiatives that the ministry has taken to promote the medical tourism, and Abhilash is already there, and his father, Mr. Ramesh. So he is also the member of the National Medical Tourism Board, which is chaired by the Honorable Tourism Minister. So this tourism board is also working on the side of the visa. The ministry had taken this issue with the Minister of External Affairs, and the Minister of External Affairs. We also actually requested the Minister of External Affairs to introduce not only Ayurveda as in the category of the medical visa, but whether it is possible to have a separate Ayush visa or the Ayurveda visa. And wherein they replied that they have sensitized to all the Indian missions abroad that the Ayush is also a part of the medical visa, and they have requested all the Indian missions to consider all these applications, because we received this communication from some of the hospitals and associations from Kerala stating there are some of the countries like Russia, where there is some problem for the people to get the visa to come to India and to take Ayurveda treatment. So this we have already taken with the relevant counterpart in the Minister of External Affairs, as well as with the Ministry of Home Affairs. So the various issues which we come across, so we immediately take up with the various ministries, and the entire government is working in a common voice. They are working harmoniously, and they respond to each other and they cooperate. So I'm thankful to FICCI as well as the entire government of India for supporting for the promotion of this Ayurveda, the Ayush, and the medical tourism. And we are always open here for any kind of request or any kind of suggestions so that we can promote the medical tourism. The last thing I would like to suggest that unless and until the state governments are very responsive for this purpose, the medical tourism as what we actually expect may not increase. So all the stakeholders, I would like to say that through your channel, you also take up with the state governments. We are already in the dialogue with the state governments, and let us actually promote the Ayurveda medical tourism all over the country or in all the states. Thank you very much.
Thank you, Dr. Manoj Misri. Excellent. And you are actually playing as per the requirement of the industry. Your NABH dialogues, you are taking up of the promotions, everything. And on behalf of the Tourism Subcommittee on Ayurveda, and also on behalf of the Ayurveda Promotion Society of Kerala and India, we extend all our support for Ayush Ministry to go across the borders to promote Ayurveda in the future. So please always keep in communicated with us, and we will give representation through FICCI as well as with our associations, so that any policy interactions is happening, just include us, because we people are in the field for more than 30-35 years, so we can give more valuable inputs what's the client requires, as well as the international market conditions, because tourism is a way forward which has done almost 2 decades before going into ITB and WTM, like Abhilash father, Mr. Ramesh and all. They established a marketing synergy with the overseas countries almost 20 years before. That is still continuing and going very strong. So make use of the resources which we are having, and we will give a representation. Jyotsna ji will give our requirements to you. So we are ready to associate with the Ministry of Ayush, and we are always ready to associate and work together so that our dreams and aspirations come true. Thank you once again, Dr. Manoj.
Sanjeev, one small appeal actually I just forgot to mention in my talk. It is related to the various requests that we are receiving from various countries to establish Ayurveda centers in those countries. We have received this kind of request from Mauritius. We have received this communication from Germany. We have received this kind of communication from Morocco, and there are many more countries. And regarding that, we have already written to FICCI. I'm sure that Dilip ji and the Praveen ji, so they are aware of it. So I request again to all of you that those who are interested to establish the Ayurveda centers and the institutions in different countries, the ministry will provide the total political and the regulatory support to establish such institutions, and let us have more and more Ayurveda in the entire world. Thank you.
Definitely, sir. We will take it up with our counterparts in the industry who are interested, like Abhilash and all. They are focusing more on international. Whereas, only thing I want to say that when we promote Ayurveda, it should be genuine Ayurveda, because it should not be a massage. Being a doctor, I don't want to explain you on much. But our focus is our strength, our tradition, our values. So that's that we are ready to give this data to the interested people among our group. Thank you very much once again, Manoj ji, and we will keep in touch, and we will keep in the way forward. Thank you very much. Now let me come to the most dynamic, the person in the tourism industry, in the tourism department, Government of India, Madam Rupendra Bar. She is the additional Director General of Ministry of Tourism, Government of India, and is responsible for all the tourism promotion in India now. It's a very valuable, very capable, very strong position where our expectations level of international marketing as well as domestic market, she can help us a lot. She is a 1990 batch of Indian Revenue Service. She has served in different assignments all over India across wide spectrum metro cities like Mumbai and Patiala. Mrs. Barr has held assignments in international taxation, corporate taxation, tax administration, and citizen services division. Completed masters in modern Indian history, a very rare what you call a subject where it's very happy to see that established a master's in modern Indian history. In 2009, Mrs. Barr went to Singapore University on a scholarship to undertake the masters in public administration. She has also recently completed law from the Mumbai University. So such a dynamic person, and I welcome Madam Ravindra Brown to address this webinar.
Thank you, Sajeev. As you can see, I am traveling, and so the doorbell kept ringing. I had to go and see that. I am in Srinagar. And thanks, Sajeev, for very kind words. Am I audible? Sajeev, am I audible?
Yes, ma'am, very much.
Okay, great, thanks. Because I'm talking from Srinagar and connectivity can be a bit of a challenge here sometimes. And so thanks so much for a very kind introduction, and a good evening to Jyotsna ji, Dilip ji, and it was amazing listening to Manoj ji. Some fantastic work happening in India in a sector which is clearly India's USP. So I think from the tourism perspective, it is just the right time to be pitching Ayurveda. Clearly, this is one of the silver linings, should we say, out of a pandemic, which has otherwise literally mauled, I should say, travel and tourism and hospitality. But we have been trying to look for those takeaways from the situations that become challenging. And in India, if we see, and I'm glad that is something being highlighted and noticed, not only in India, but all over the world, that the strike rate, so to say, of the pandemic has not been as harsh as in other parts of the world. And when initially this started as a narrative, we were still a little tentative about it, because obviously you didn't want to count your chicken before they hatched. So now that it's been so many months, I think as a country, as a people, we can pat our back and say that there must be something in the lifestyle that we have in India that kept us going strong. And I would take the cue from what Jyotsna ji said, that perhaps particularly for all of us in India, because it's a way of life, because using certain herbs, using certain elements in our foods or our everyday existence is just so much a way of life that we probably haven't even been looking at it as a potential area on which we should actually be strategically working. But that's for the domestic part of it. As far as the global part is concerned, I think considering the amount of focus that India is now giving, and Manoj ji very rightfully mentioned that the Honorable Prime Minister himself has mentioned on what the coming times signal for India. And it's a very exciting time, therefore, I should say, where so much focus is being given back to a very ancient wisdom of the subcontinent. Because this is not just a science, or this is not just a methodology of massages, but it's actually all about healing. It's about rejuvenation. It's a science of life. And it's time for us to take it forward. And it's, I think, a great opportunity for us in the government and for all of you in the industry to join hands together and to carry to the world the India story in terms of the Ayurveda. And Ayurveda, to all of us, I'm sure we agree, we understand that when we are talking here of therapies, when we are talking here of a way of life, it's almost like an alchemy. It's about everything coming together in the right way, as they say, the Ras Shastra. And that's where I would pitch myself from the tourism perspective, that when we now carry the whole story to the world, I think we've been doing it pretty well. And that's why states like Kerala have actually benefited so much from this. However, more needs to be carried. We need to move away from just conveying one kind of healing to a more holistic healing, and coming as it does post-COVID, where the world has literally been ravaged by the virus. it would be a fantastic messaging. So I think one of the things that I can take away, and we are already trying to do that in the ministry, is to create new kind of promotional material that talks of body, mind, and soul, and where Ayurveda actually pitches in creating a holistic improvement, a holistic rejuvenation, and saying that here in India, we've had an ancient wisdom. It's part of us even today, and we need to share it with the world on how to become healthier, happier, and just more complete as a human being, especially in today's world, which not only because of COVID, but even otherwise, if we see the kind of stress related disorders and chemical related disorders, climate change, there's so much happening in the world which is adverse to human existence. And in that time, to create a way of life which is not just based on some intuition, but it's highly scientific. And therefore, to build that narrative that it is not just something that has evolved by custom, but it is there because it is rational, because it is scientific. I think that's the kind of narrative we will need to build if we have to grow it as an element which is very attractive for an inbound traveler. And we hope that we can work with you, the committee of the FICCI, also in strategizing and pitching that which are those elements and which are those countries or people who would value it more. We do have some traditional partner countries, but I think we need to work more in creating the right strategic content and also carrying it into the right markets. So that's one part of work which certainly needs to be done. You've mentioned about the need to harmonize movement between the state governments, and it has also been mentioned by Manojji on the role that the state governments themselves have in kind of identifying, I would say, the elements in each state, that what is so unique about that state when it comes to traditional ancient healing systems. I think the dialogue with state governments will definitely need to be escalated and enhanced more and more. We've had a few rounds of discussions already with the state governments on the need to harmonize. It has helped, but clearly a little more needs to be done, because within India, at least, movement needs to be of one kind. And as we look at it now, there are really no hotspots. And if there are any, the state governments, of course, are free to identify them and mark them as not accessible for tourists, because clearly we don't want to burden the medical system. However, considering that vaccination has already started in a nascent manner, and the rate of pandemic is also fairly low now in the country, it's clearly time for us to have another dialogue with the states. And I'm happy to share with you that as I go back from Kashmir on Sunday, from next week itself, we have actually planned meetings with state governments, and this would remain a high priority area for us. Coming to the other part, the medical visa, you've already mentioned that some efforts are already being made with MEA. Well, we are in fact already in close conversation with the Ministry of Home and Ministry of Health in getting their inputs, that if India were to open the visas in the coming times, not just the medical visa, but also the overall visa, then how should we be prepared as stakeholders to ensure that it should not be a story of going 4 steps ahead and coming 2 steps behind? Because clearly, whenever we open, we need to be very robust in the systems that we provide to the inbound travelers, because it's the word of mouth, it's the experience that these travelers will have, because the world is literally kind of closed, and when it opens, it's going to take very nimble steps. There is going to be apprehension, and that's where I think we all will need to come together and make sure that our systems are in place and we do not have any negative stories that get carried, because I'm sure you'll all agree that while positive stories carry really strongly, however, unfortunately, the negative ones just seem to have a faster pace of carrying. So we definitely will need to work a little more with all of you to ensure that that part is really strong and comprehensively provided for. Having said that, and in terms of pitching for Ayurveda, I think nothing nothing that we do can be enough, because this is clearly a USP of the country, and we must really take it forward. And my own understanding and my own experience, as I'm now there for 15, 16 months, is that if we can lace together the things that are unique to the country, and not just Ayurveda, but also linking it with the whole spiritual journey that a person can actually experience in India, it would be a fantastic takeaway for any traveler. And if we look at the three words by which the book and then the movie became so popular, eat, love, and pray. I think India, for all these three elements, has so much potential. And if we look at eat, the Ayurveda way of cooking, spices in the Ayurveda food trail is something remarkable. It is so healthy a way of cooking. So even if we just do that part of the Ayurveda and pitch on that exciting, very exciting vertical. If we talk about the love part of it, it's the bhakti part of the whole process, that comes through. And in entire India, whether it is the southern traditions or whether the northern traditions, or if you go to Bengal, the ball traditions, I think everywhere in India, the way we are hospitable, and that's why Atiti Deva Bhav comes, because love is not to be understood in one form. And pray, of course, reaching out to forces that are beyond, that are above us. I think these are some very, very unique strengths that India has, and we must work together to develop them. And therefore, my own sentiment on the whole thing is that Ayurveda is a way of life, and we must take it forward. And we are with you in the industry, and do write to us and do share with us what kind of elements that we should be sharing. Because the last thing that I would like to say is that as an industry, if we pitch anything, then we must actually be able to offer those things. My promotional campaigns must not be divergent from the experience that a traveler is going to have. That is the kind of integrity that must be there in the message that we create and carry to the rest of the world. So with those words, I'd like to thank FICCI for, as always, choosing very contemporary and very effective and useful topics. And this one is really a critical topic for India. So all the best, and I hope we can work together to take the India story forward. Thank you.
Thank you. Thank you very much for your brilliant insight, Madam Rupendra Palji. We assure you that, your vision, your commitment, and also your, what you call, expectation levels, which the service provider sector from India all across the Indian states, we are very much committed to give the services, and we are very clear on our modalities of taking India's national pride, the authenticity of the Indian Ayurveda system, without any color of additions, flavor, or anything. Because, it's a 5,000-year-old history, and we are the torchbearers of that. And we assure you that, we will take care of the commitments which our forefathers has given to us. So it is something like a combination of tradition and the modern hospitality, the merging, which is actually being practiced now, which is having a lot of intakers. Our people, the friends from the webinar, Mrs. Irina and Mr. Shubham, like people who are experts in international marketing, and we are getting the insights to our webinar members. I am very much thankful for you to spend the time from Srinagar, amidst of your busy schedule, Madam Rarji, and we love that you continue. I am sure that you may not be able to in a position to continue full time, but we will be giving the recorded points through Manish and Dilip ji to you, and we assure our wholehearted support, FICCI Ayurveda Tourism Task Force, and also on behalf of FICCI Tourism Committee. We are all together with you, madam, and we will go together. Thank you very much.
Thank you, Sajeev.
Now, let me come to the different perspective of introducing the panelists. I will introduce one by one. To start with, I made it as being a moderator, I made it as two aspects. One is the service providing aspect, the expectations as far as the service provider perspective. Mr. Abhilash Kairali and Manu Gupta, two of the eminent people in the service sector, will start And I will start with Abhilash. Abhilash is the Executive Director of Kairali Ayurvedic Group. He is the eldest icon in the next generation of Kairali Ayurveda Group and an engineer by profession. I know Abhilash from childhood, so whatever I say, it is without any papers, I can say. His father is a very close friend of mine, Mr. Ramesh. Abhilash, he is an accomplished business leader and with experience in extensive interest in marketing, international business, MIMT, joint ventures. Abhilash Mission has always made Kairali Ayurveda way ahead comparing to the competitors. Abhilash was recently awarded among the 40 most influential leader under 40 by Asia. Asia won along with the Asia Pacific Entrepreneurial Award in 2016. Most promising category, the Entrepreneurial Experience and Excellence Award for Ayush Leadership in 2017 and 2015. So he is the recipient of a lot of awards, and he has taken the Kairali Group way ahead in the last 5 to 6 years. And I wish Abhilash all the success, and I invite Abhilash to give your insights on the particular subject for this webinar. Thank you.
Good evening, everybody. Thank you for having me here. It's an amazing opportunity to be on this panel. As a representative of Kairali, we are into service, products, training, and centers, inpatient centers, as well as outpatient centers across the world. So we have a unique perspective on certain things, but let me stick to the service side as of today. But before I start, I would love to thank the government, Manoj CG, as well as Madam Raji, for your immense support to our industry over the last few years. Pre-COVID, it was actually a booming time for our industry. We were all doing really well. There were no complaints. I guess when it was going good, we tend to ignore the smaller nitty-gritty things. But now it's a time where we need to really focus and restart, because most of us are at zero and on the service side, or near to zero. The two major efforts I think would be, this is my opinion, and these are not complaints. I think this would just be certain things that we can take forward. Our two focuses are going to be the domestic and the international. As Jyotsna Madam said earlier, domestic tourism is something that we cannot ignore. It has tremendous power, especially in India. In our company itself, we were now 35% was from revenues from the domestic tourism side, and it was growing, which initially used to be 5% or even lower. And I think just the ease of travel between the states or including in the state and quarantine measures, we should not go 4 steps backwards, as Madam mentioned. We should be safe. We have opened our in-house day centers across India, but with social distancing, with more stringent protocols. Something of those measures need to be taken care of, because it's a touch-based industry, and that's an easy way of spreading something that is not required to be spread even more. In terms of the international tourists coming into India, I think we are going to be competing with other countries as well, which will be opening their borders up soon. There should be an added advantage coming into India. Yes, they are selecting India for Ayurveda, but as we know, there are other countries also that provide spa services or Ayurveda services as well in similar properties or luxury properties. And we should be more competitive in getting, when the visa processes start, at a cheaper cost or at a no cost for a certain period of time for key countries that have been driving or will be a potential to drive more business into India. The e-visa facilities really help. The medical visa facility also really helps as well. I think those are great points. But coming back now for the domestic tourism, as we have now received that Ayurveda alternate medicine gets covered under insurance similarly, but it is a very limited coverage, I think, but we could increase that. It's only 7.5 to about 25% currently. but I think we could increase that such that it will boost and enhance the domestic markets to visit us as well across India. That should give a great mileage for us. In term as well as when we do start getting all our tourists coming in, yeah, I think the states also and private players, we need to focus on our infrastructure and create robust systems so that when a foreign client comes in, they do see some change, they do see some development in terms of be it the road infra, the airport infra, or be it the way they are handled when they came into India. Vis-a-vis, it should not be what they saw a year and a half ago is the same that they see now. We should invest in something, maybe even if it's just soft skill training, things like that. It leaves a better impression, and people would actually remember that, oh, there has been a lot of foresight and thought gone into it. And as Madam mentioned, our marketing campaign or our reach out to our audiences now shouldn't be more towards educating them about, say, Dinacharya or about the benefits of Ayurveda, and be it in the domestic market or in the international market. And domestically, we did promote Chavanaprash, Anutailam for Nasyam, certain tips that a lot of people started using and adopting in their day-to-day lives. I think that also should be projected internationally as well, how Ayurveda can become a part of their lives as well. So it's an easy step into their day-to-day psyche, and then which will definitely inculcate some curiosity to come and visit the land of Ayurveda. I think if we start from here, it's a good stepping stone forward, and we should. I have no doubt that in a year and a half, 2 years from now, we'll be better and far ahead of what we were pre-COVID. Thanks, Ajit. Over to you.
Thank you, Abhilash. Since we are running short of a little bit time, I'm coming straight to Manu Gupta. Manu Rishi Gupta is the CEO of the Ramayam Business Group, the hospitality arm of the Jupiter Capital. Manuji, I think we may have to stick on to the timing. Sorry, because it's a little bit late, but you can come with your valid points, and I will sum up all the points together in the last. Thank you. Over to you, Manu.
Gigi, I won't be long, as they say. So I'll be short and quick. Mrs. Bra, thank you very much for your great thoughts. Mrs. Suri, thank you all for being here, and thank you for having me over. So I have three broad aspects to the 5 minutes that have been allocated to me. A couple of very specific requests for thought leadership for the Department of Tourism, because we have the luxury of Mrs. Brar being on the panel. You see, we often, it is pertinent to mention that about 12 to 14% of our recorded employed workforce is employed by the tourism department. And I would say another 5 to 7% informally. So since our statistics are not terribly strong, it would be prudent to assume that 20% of the workforce is employed by tourism and food and beverage industry. Now, the way we have been affected, I'll give you a small example, that our revenue, which on a per room, per annum, per key basis, we used to do about 60 lakh rupees per key per annum, is down to about 4 lakh rupees per key per annum. So the way the industry has been affected, and we've had to lay off people, we've had to very, very painfully try to cut our costs. And today if we are surviving somehow is not on the basis of any great thing or the revival that we are seeing, but because we are taking a lot of opportunities and salaries and benefits away from 30 to 40% of our workforces that we've had to let go. So I think one of the things that we need to figure out is that the 50 million people who travel out of this country on an annual basis, how do we disincentivize them, or alternatively incentivize them to appreciate the virtues of traveling within our country. Now, if somehow some serious thought leadership could be applied at the level of the ministry, at the level of the Prime Minister's office, the finance minister, the income tax, the tax benefits, that if somehow we could retain those 50 million people to travel within our country, look at the kind of traction that it would create economically, how the industry would revive or almost immediately, and how this sudden economic stop that has happened to this industry could possibly be reversed. I mean, COVID, vaccine, all these things are all things that we don't have a control on, because we don't know how the virus or the second wave or the third wave is going to evolve, how effective the vaccine is going to be. We all should remain positive. But if we can solve for one thing, how to either disincentivize or incentivize those 50 million people to start appreciating domestic travel, I think 50% of the problem stands solved. So that's my earnest, humble request to a person of your eminence, ma'am. Talking of the virtues of Ayurveda, I was on a con call with Dr. Siddharth Mukherjee. So I'm going to propound on the benefits or the greatness of Ayurveda for the benefit of all the people who are listening to this. I was speaking to Dr. Siddharth Mukherjee, who's the head of oncology of Johns Hopkins, and he's also a Booker Prize winner who's written that amazing book called The Interpreter of Maladies. You know, the takeaway from a 1-hour discussion that I was having with him, because he's on a panel and on the board of one of the joint ventures that we are trying to evolve and develop, is that ashwagandha, turmeric, garlic, and the right breathing are the 4 things that can probably solve 80 to 90% of the problems that humanity is facing. Very, very powerful statement coming from a person who practices allopathy. So that probably should give us the confidence how powerful this 30,000-year-old science is, and how important it must be. It should not be a side department for anybody. It should be the number 1 priority for the government of India. That the world and the top oncologist on the planet is talking about the 4 virtues of Ayurveda, and just says that, you know, just the right breathing, consumption of turmeric, garlic, and ashwagandha can probably solve 70 to 80% of the problems on the planet. So that's point number 2 that I wanted to propound on the benefits of Ayurveda. Point number 3 is what are the customers' expectations, and it could be a learning for all of us, because it's been a voyage of discovery for us as well. Our average length of stay used to be only 3 to 4 nights, because we are not only an Ayurvedic retreat, but also a leisure retreat. In the AC world, as I call the after Corona or the post-Corona world, we've come to realize that all of our guests want a tangible takeaway. Earlier, people would come for a holiday to indulge in excesses. It could be an excess of food, it could be an excess of gastronomy, it could be an excess of drinking, and an Ayurvedic course or a yoga thing could be a add-on to everything. Today, people are asking for courses on immunity, courses on detox, and they have started asking us a question that we don't mind staying with you for 7 to 14 nights. And we can even work from your place as long as the internet is good, because the Zoom and the new technology has allowed us to find our ways around without going to the office. And you know, we've suddenly come to realize that all the people have become terribly efficient. So people are looking for tangible takeaways. People are no longer wanting to indulge in excesses, and people are asking us the question that the 3 major problems, as they are defined under the medical science, like the comorbidities, the diabetes, the hypertension, and the obesity, how we can solve those problems during a 7 or a 14-night holiday. So I think that all the hoteliers who are part of this forum need to solve for that. And it is also known, identified, and established that 70 to 80% of all problems of humanity emanate from these three broad problems of obesity, diabetes, and hypertension. And I think we need to solve for that and market that in a manner through our programs, through our initiatives, as to how we can use these three things as a bandwagon of growth for Ayurveda, because for most of the people, Ayurveda can be pretty cumbersome as well. We need to kind of, sorry to use the word, but we need to kind of sexify Ayurveda in a manner that it becomes relatable for most of the people. It becomes easy to emulate. It becomes easy to go for an Ayurveda retreat, and I think that's what we need to evolve through our programs. And lastly, I'd like to share the one major learning that I've got through this pandemic and as an industry. We never used to appreciate or concentrate on the virtues of domestic tourism or our domestic guests, because we as a brand used to get like 90% of our customers from foreign countries, primarily UK and Germany, only to realize that all of that has suddenly stopped, and we have not created enough traction for attracting and appreciating the domestic tourism. And the first request that I made to you, Mrs. Brar, was that we need to figure out a very, very efficient, well-oiled machinery to somehow retain those 50 million people and encourage our domestic people also, that Ayurveda does not really mean that you cannot go for a nice leisure holiday. Ayurveda can very well be a add-on and an integral part of a family holiday. And if we can solve for that and communicate that effectively, that itself will be a harbinger of an entirely new ways that we look at our industry, and the way the Department of Tourism or the Ministry of Tourism or the Ministry of Finance looks at Ayurveda as an industry or an engine of growth or retention for economic development. It's not just a side industry. It is the main engine, if I may, and if all the parameters and pillars are handled well, I think this can be one way and catalyst how we can probably come out of COVID as a country, and how we can come back from the economic hardships that pretty much every single person on this planet has gone through, more so a reasonably poor country like India. I think I might have covered most of the things. A few requests, a few recommendations, a few lessons that I've learned from myself. Thank you very much for this opportunity. Have a good day.
Thank you, Manu Gupta, for your valuable insights. Now let me come to Mr. Swaminathan. Swaminathan is the Managing Director of Dravidian Trails Holidays based in Cochin. The specialized tour operator who handled foreign nationals visiting exclusively Kerala and also South India. It was founded in 2009. Dravidian Trails has welcomed thousands of visitors and become the model of the global travel brand. Prior to this, his own personal company, Swami was associated with the different companies, and he was the Vice President of Koni Destination Management for South India. We are working together for a long time, almost 20 years. So I don't want to give further introduction to Swami. Swami is an expert in both domestic as well as international client management, as far as a travel agent and owner operator. Welcome, Swami, for your valuable inputs.
Thank you very much, Sajeev, and thanks to everyone for having me in this webinar. Well, as you rightly said, this good topic, because something where, we always have, globally, everyone comes to India in spite of in the most expensive brands also come to India targeting 3 to 6% maximum our population, which could be 20 to 25 of different countries, whereas we are yet to target officially or a structured way our own countrymen. So even if you increase 10% our own countrymen, Ayurveda will become one of the best possible way. Before I go further, let me tell you what is the learning and transformation, which is going to help more for our own countrymen and for everybody with regard to the Ayurveda way forward. See, now this current pandemic has made us or taken us to the social media platform, or it has, all our activities has come in the digital platform. That will be the more appropriate. And this is also the time where people needs to become or made to become self-reliant and practice, do it yourself. So that has become the necessity. And the most important, you can work from wherever you want. You can also work wherever you are comfortable with. So this transformation has led it to the workation very actively. So this workation segment is definitely going to help Ayurveda in much bigger scale. So when it comes to domestic market, whatever you talk, whatever you say, in reality, in sales, value for money has to be the best. When I say for everything, value for money needed, for domestic market, people actually expect more value for the money. And also with regard to the marketing, like many, even Madam, Randit Bar has also explained, and many has said, the mindset of Indian people, that needs to be changed in the marketing. Because as we were, we are happy to, even you will agree, Sajeev, everybody would like to follow when we are saying what mother or grandmother is saying. The moment we go to allopathy for quick reactions. It may be because of way of life of Ayurveda. Like we already know turmeric is good. You have been told many situations. So buying something which you know is not easy. You already know. You take it for granted. As you said, we have a lot of history behind. So many things we take it for granted. So that may be the reason why Indian audience in general, or addressing naturally for masses, Ayurveda may not be a concept, but we have to create awareness. So this is where the awareness creation is coming. I also just thinking, I don't know how it is possible, because Dr. Manoj is also there, if I'm right, he's still there. If you remember when we were hanging out, people of our age, that's a time where this craft classes started in the schools, or I think, so some kind of a craft classes. So why can't every organized school, if possible, once in a month or twice a month, have a wellness program? It's important to say beside the hygienic, because now your health is more important to other man's health. Like previously, you have to take care of yourself, but now you need to take care of yourself because for others' reasons. So now the issue, why cannot every schools or wherever possible, any institutions can have one kind of a class, maybe 20 minutes, 30 minutes, not only for yoga, including Ayurveda, how it is beneficial. So that will be the way we start from the grassroots. But having said the same, value for money will be there, less interest are still there with the countrymen. All those things will be there, but there's a huge opportunity for travel and tourism and hospitality industry to focus on Ayurveda tourism. So how we do? Number one, we have to focus on the product. When we say product on the product, I think as Abhilash has correctly said, whenever customer is coming, they should feel the difference, having the confidence of how we have transformed. When he comes from other side, like whatever the maximum protocol needed. And as we all know, Ayurveda is something which is where the human element is involved. So how the human element, he works for 10 days in 1 week, or he works for 10 days, only one customer works for a client, then there is no need of change of any therapist, or the kind of treatment is given. So there is a change which they see, which builds up the confidence. And then because of this, word of mouth also will come. The marketing of Ayurveda to the domestic crowd is not easy, because you have to change the mind perspective. So it has to be a continuous non-stop process which needs to be done. And having said the same, this is also the time where, you have to create high-speed internet so that we can target both professionals as well as other needs pieces. And it needs to be clean and hygienic, which is needed to be maintained. I don't know, am I giving a right statement? Maybe Sajeev, you can later correct me if I'm wrong. If there is a possibility, a small adjustment of diet, if there is a possibility, which could mix just rather than just being overall, so that it encourages professionals also to come and participate when they have, because the organization today is allowing you to work wherever you do the work, which was not the case before, because this was not the case. So we have to capitalize on these kind of situations. And having said the same, when we are targeting Indian audience, if we are successful, let's say 2 years from now, The current infrastructure is only 10% of the population what we have, or not even, it could be a very minute population. So we have to ensure the infrastructure is also accordingly developed, which means when you have the colleges which are well connected, you have a qualified doctors, you have qualified therapists, and all people, as you said, medicine which is needed, every infrastructure need to be taken care. It is a challenge for Indian customers to take Ayurveda in a structured way. It's still happening. It's still happening. There'll be more people coming for the kind of treatment when they become little old. They who are believing. Younger generation is keen to do it, but they know it won't be a quick results. So this is the challenge which we are having. You have to make sure or educate them in a way that the way of life of Ayurveda is also very important for you to undergo. So if that particular segment is taken care, then it will be a very good transformation is what I would ideally say. Overall, domestic audience is capable of understanding everything, is capable of converting many things. We have to target them in a much more structured way. That will be the one option. And having, I think already, Mr. You have addressed it. I think Abhilash has spoken, also Dr. Manoj has given it. Insurance is something very, very important today, always, but today it has become more important. So that kind of even small and medium, well-cleaned hospitals can be taken care without compromising on quality. I mean, it doesn't mean that quality is less, insurance is given. So that kind of applying for insurance should come. To make it in nutshell, because the time is running short, so let me cut down. To make it in conclusion in nutshell, every change made by nature or by science opens new doors or window to the world. Then pros should be addressed, accessible to everybody. Cons should be addressed in a way that the society is benefited. And Kerala being the capital for Ayurveda and wellness, in the reborn tourism industry, it is going to do very well. And thank you very much.
Thank you, Swami. Your Manava Seva is Madhava Seva. But treating people is like treating God. And just to, before going to Irina, I just want to say that, for wellness vocation, which is now the focus area for Ayurveda, there is no rigid rules for going for the diet pattern. A diet is actually given for people undergoing Ayurveda treatment for the, what you call the treatments. So there is a relaxation for both. Now we are all doing that, but there is more to do with the vacation, what you call marketing. And I started this on the 15th of October, and I think I have already covered around 15-20 people, high-end executive, senior officials from different companies. Anyway, thank you very much. Now I come to
thank you.
Irina. Irina is the owner and managing director of Top 2 LLC based in Odessa, Ukraine. She started this company in 2010. Ever since she started that, and she is having an urge to come to Kerala and settle in Kerala. We are friends for a very long time, from 2010 onwards. And I think every year she sends more than 300 people to Kerala for authentic Ayurveda as well as wellness Ayurveda. Over to you, Irina, about your expectations.
Nice to see all of you. I will try to comply with the time limit and make a speech in 5 minutes. Pragmatism insists of understanding how to make the entry of tourists, how the entry of tourists should be regulated. So first of all, I just would like to gratitude all Indians, someone of my partners, someone whom I know, and someone I'm working with 20 years, because I started the company in 2010, but honestly, I'm working in Ayurveda the last 20 years. So I'd like to gratitude all Indians busy in Ayurveda industry. I know this job, and I know how a lot you are doing for us. And from my 20 years experience, 99% of people arriving annually to Kerala for Panchakarma or even for Ayurvedic holidays. These people keeping their health and immunity much, much stronger than others. That is what I can tell you absolutely honestly and absolutely sure about it. 70% of people coming to resorts, they'd like more freedom to travel. That's the challenge for us now. Others are okay to stay in NABH properties, But even these people, they wish to stay in nice nature around. That's why so many people choosing Kairali, many people choosing Ayurveda Mana, many people choosing Soma resorts because of nature. And Ayurveda, it's really nice to do in nature. For the foreigners, it's the most important, because now in India, you have also a lot of nice modern hospitals like Sanjivanam, for example. But some of them are getting the location which is not so much attractive. And again, from my own experience, better to get Panchakarma and better to get Ayurveda treatment being contacted with nature, because then you have 25 more better results. Problems which must be sorted out before you start to meet foreign patients. Can I just point a few of them? The first point, mostly, and I'm talking now not about, how to say, my message is not to Ayurveda property owners. You should understand it. My message is to the government persons, to the persons who are really responsible for the starting of Ayurveda in India and Kerala again. So the first point is visas. Embassies are not accepting now any option, even medical. They said that they will be accepting medical visa. They will be accepting the invitation from the NABH properties. But really, in reality, it is not doing like that. It's not working like that. So the other one, what I'm looking for the future. So the government should be, and you must ask the government about the special wellness category of visas. The case of visa provision must be discussed very, very clearly with Ministry of Foreign Affairs, because without visa, all we are doing now, it's nothing. The second part is the situation with COVID tests. I just would like to point you and see experience of Maldives Islands. They are really great done this last season, because they have clear protocol with a test application in self-health declaration with uploaded photo of person, photo of passport, and attached test for COVID. But in the future months, we will have even more possibilities. For example, we can get a vaccination passport as well. So it also should be used in application, in special application. The same can be applied to declaration. That's the second part, which I would like to speak. The third part is COVID insurance obligation. It must be very clear and has to be done in case of any health problem. Because now, from my 20 years experience, always the tourists sorted out these problems themselves. If, for example, if I'm in India, always I'm just assisting, I'm helping people to sort out this problem. But this should be the exact protocol for COVID insurance. This should be determine the protocol of medical assistance for foreign tourists in COVID period. The fourth is a good connection of each Ayurveda property with immigration authorities and immediate reaction if any problems with people who are coming to Ayurveda resorts coming. The fifth, another problem, rules of countries, which is not depends on you, but I think in the future year, 21st year, probably we will lose 50% of foreign tourists who are mostly ready to come to India. But even India will be opened, they will be forced to stay isolated in their country coming back. That's the other problem. And this problem is very clear. And it doesn't depend on us. We can just speak about it and crying about it. Last but not least, it's the airfare. So now there are 3 modern airports in Kerala. One of them, the last, I've been in March, Kannur Airport, which is great. Cochin Airport, which is great, and Trivandrum, which is also very good. And the airports also should be ready to be hosting and to be clear with the passengers. Because sometimes I see that airport authorities, they are like, how to say, this soft word can be unhosting, like that. And that's also topic of discussion. Topic of discussion with Ministry of Aviation, with airport authorities. Because some people should be very clear and clearly understanding what is going on immigration part. Then one of the points which I was very much worried, Ayurveda properties lost hundreds of staff from Nepal. It's another part of my anxiety. Takes much more time to get the same stuff, which was very good value for money. So just to finalize my speech, we need huge support from government, huge, maximum support. Ministry of Foreign Affairs, Ministry of Aviation, Ministry of Health, Ministry of Health declarations, any Ministry of Tourism. Otherwise, the greatest point of Indian culture and science and the greatest attractive part of India, Ayurveda, it can be go down very fast. That's very sad, but that's a reality which I can see. And I understand that India is a great country, it's a huge country, you have a lot of domestic tourists. But again, from my private opinion, Ayurveda mostly based, the most famous properties in India based on foreign patients. That's it. So asking very polite, very kindly asking the government to assist us. Pass my gratitude to everyone who is doing something for that. Thank you.
Thank you, Reena. All your requests, we have noted. This session is being recorded, and the FICCI national team will make the points. Each points you have covered, your anxiety, your requirement as far as an international operator is concerned from the client side. All those points from a little bit of our experience, we are also aware. Now it is the time for rejoining and reworking together, and hopefully it will be soon. You get, because since Sri Lanka is planning to start from 21st of January for international clients in a very, what you call, professional way. India will have to, we cannot wait for long, because the aspirants like your clients, your team, like a lot of people are looking for, and we are expecting this will happen once the vaccination days are over by 15 days, and the flight connectivity is the main problem now. And the fares, all these things, the points which I have mentioned is absolutely pinpoint. We will take it up definitely with authorities as a request from an international operator who is loving India, loving to take people to for Ayurveda. We like people like you are our asset. So we will open our mouth on behalf of your requirements. And thank you very much on behalf of the FICCI team to spend your time and expressing your views. Thank you very much, Reena.
Thank you.
Now I will go to our last speaker. I kept Shubham Agnihotri last because this is something which is a new thing which we want to emphasize. Shubham Agnihotri is an architect and promoter of Kerala Ayurveda Tourism Development Project in Taiwan. We have seen people from different parts of the East Asia, but Taiwan is a small country where he is doing emphasis to the Ayurveda, and he is spending his time, energy for a lot. And we met during last year when our International Ayurveda Ambassadors tour happened. And his efforts, even with the COVID time, Taiwan is almost a free country without much COVID problems. Now it's open to Shubham Agnihotri to come and share your views and expectation of taking Ayurveda future in the post-COVID scenario. Welcome, Shubham.
Thank you very much, Sajivji, and greetings to all the eminent people over here. First of all, the 2021 has started with a wonderful note for us. The reason being the vaccine, which is now in India as well as very soon in Taiwan. And we are hoping that the air connectivity to Kerala and India will open very soon. Taiwan government has put a ban on any kind of outbound and inbound tourism till October 2021. So we still have some time to do some more activities here in Taiwan and prepare ourselves for a wonderful season immediately after everything is normalized. Just to give you an idea about the scope that we have been working on since 2017, Taiwan has nearly 23.7 million people, and out of which in 2019, 15 million trips were made overseas for tourism. Now this is outbound, and approximately around $28 billion were spent on outbound tourism. So Taiwan is one of the few countries who spend quite a lot on tourism. 80% of this money was spent in Asia, and half of it went to Japan. And the rest is distributed in Korea, in Hong Kong, Singapore, in China, and some other countries. India has a very small share of business from Taiwan. There is only one direct flight that goes from Taipei to Delhi. It is stopped now. It's going to restart in April, hoping so. It basically carries people to the Golden Triangle, and that's where it is. Some individual travelers know about Kerala, but there's very few. So we identified this opportunity in 2017, and we gave it a full-fledged project shape here in Taiwan. Today, we are in a position that we have taken Ayurveda as not just part of tourism, but a complete holistic approach. We are on our way to form the very first Ayurveda association of a national level, and it will be formalized by June, July, hoping so. Ministry of Interior, we are working with them on this one. Our approach for Ayurveda is that we cannot just promote tourism, but because that's not going to bring the passion and the knowledge in the people. So we start observing that how come the Japan and Korea, they're having so much business from Taiwan. What's the reason for that? And what we found was something very interesting, is that Japan and Korea's natural products, the naturopathy products, were in Taiwan market, and they were flooded almost everywhere. So people had lots of awareness that yes, that's a good place, and so I did got some products over here that I wanted to show you. So this is from Japan, this small one is for any kind of ailments on your stomach. This is just a natural thing. And there is one from Taiwan. Now it has got clove and cinnamon on it. That's a powder to it. It's all natural. So what we are thinking is that if we have to make an Ayurveda tourism project success, we have to have a complete ecosystem of all the goodies of Ayurveda. For example, the products, for example, the education of the people, the cosmetics, and also we must have set up here some kind of therapy or some kind of cosmeceuticals, or maybe some kind of maybe Shirodhara, some kind of cosmetic. So we are working on that project at the moment. We have a wonderful team in Taiwan that we have organized. We now are having 30 people from different backgrounds, from Taiwan naturopathy, from Taiwan scientists who are involved with Taiwanese FDA. We have people coming in from tourism industry. We have people coming in from trade promotion industry. We have people coming in from pharmaceuticals. So, all this collectively is going to form this project where, what Dr. Manoj has spoken, what Madam Brar has spoken, that's the exact vision that we have, that, this has to be a complete holistic approach to make this project a success. Now, Taiwan enjoys a very unique position here in East Asia, is that anything that is successful in Taiwan is adopted very easily in China. China, in fact, look forward to the things that's happening in Taiwan because it is considered that everything is of very high quality over here, and all the research and development or whatever product is a one as a great scope. The same thing is in Japan and same thing is in Korea. So we have this unique opportunity of creating a wonderful base over here and then expand to East Asia. Some of the experiences that we have in this COVID, we had our first tour that was booked from Taiwan to Kerala. This was a group of 16 ladies who were going for a training session for cosmetics, but apparently it has to be cancelled because it was supposed to March. That experience also gave us some insights. What are the ways we can reach Kerala? How we can expand, more alternatives for flying to Kerala? Before we only had option of going either from Malaysia or Singapore, but now there is one route which is probably the only route that is open from Taiwan to India. It's going via Dubai and via Emirates. Emirates is connecting to almost all the airports in Kerala. So that's, so this is also another line for connectivity to Kerala that is open up. And it definitely connects to our all the friends in Ayurveda. Some of the strategies, you all are our seniors. We are probably the youngest in the industry over here. All the strategies that you have spoken about are something that, we have to learn, we have to adopt, we have to implement. But we do need a lot of support. We do need, it's like a push and pull motivation that we have to have coming in from all directions. We travel agencies, we have to have support from service providers. We need to have, and best part, like Sajid ji, like yourself, you have a product range now, so you do understand products. So, that's our vision, that we have to have this ecosystem of service, products, education. We have to create a bridge between Taiwanese naturopathy and Kerala-based or India-based naturopathy. There has to be an exchange of people. There has to be understanding. We have to have translation of some of the texts that's there in Ayurveda and give it to the people over here in Taiwan. Like Dr. Manoj was talking about that, there are some Ayush policies and Ayush information that is getting translated. I hope they can help in something in traditional Chinese as well. This is all the things that we have envisioned. We would love to expand our catalogs, whatever we are offering here in the markets. For us, we are not a tour agent, we are promoters. And there we have 100 tour agents. Out of these 300, nearly 6 or 7 of them are working like anything. But international tourism, hopefully after October, when government gives okay, it will restart again. We want to offer these 6 tour operators, plus we have spoken to several tour operators also who are interested in having something unique with Ayurveda. They don't want to just stick to something only tourism. They want to have unique with Ayurveda. They are very interested in responsible tourism. They want to know the villages, what is village life and authenticity. So the point is that, there is a lot of scope. We are excited. We are looking forward to the October 21st. We are hoping that government will allow us to operate and promote. Last year, we promoted ourselves in 4 trade shows, in the 4 travel shows that were organized in Taiwan. Hopefully, we are going again in March this year, March or April. One of these months, we will be again in a trade show and we will be exposing the Ayurveda back to the Taiwanese people. We have wonderful Facebook page. We have nearly 4,000 people. Most of them are 40 plus, which is the target for Ayurveda, and all from Taiwan. And it's in domestically local language. And so we are getting tractions. All our posts are getting 10,000, 15,000 viewerships. So we know that there is a potential clientele that we have. It is just that we have to, make sure that, authentic, original information is communicated to these people. And whenever there is a chance, either you come over here, we can have some, travel shows, we can have some demonstrations or something organized over here in Taiwan. And then once everything is okay, they can go over there. People do understand now that there will be a requirement for stringent requirements on documentation, on submitting some medical certifications. Maybe people have to submit some proof that they have the vaccination already. Maybe there might be some preconditions which might not be allowed to travel. We do understand that this is going to cut some opportunities for people to travel. But on the side, like Mr. Swami said, that there has to be an increase in exchange of professionals, be it for education, be it the connection of doctors, Ayurveda doctors and traditional Chinese doctors meeting each other and conducting some workshops, some kind of education. So we do see that these are the starting opportunities that we have, that we can immediately start after everything comes back to normal. So these are some of the examples. Now, one thing is speaking about Ayurveda, Sajivji, I would like to show everyone one example that we have never seen in Taiwan, and that is our turmeric. This is a good old turmeric. That first time we saw this size packaging in Taiwan, we used to find them in Indian stores, but now it is coming to Costco. And this is something around 300 rupees, around 340 grams. And we believe it is packed in US, but it is coming from India because there is a map and there's a Cochin right over here. So, this is the opportunity. From here, we can make people aware that, listen, this is Ayurveda. Why you have this thing is because of this is what it is in Ayurveda. This is education. It's a new market here. People don't know Ayurveda. And this is where we propose that, something like this one. This is a monk fruit. It is a fruit which is dipped in Chinese medicine. And it is just good for throat, and it's just, something like these kind of opportunities that we will go out to these markets. We set up some small shops, some road shows where let people have the experience of Ayurveda, and they start relating it that, okay, Ayurveda is with the health and it is traditional Indian system and it has got much more. So when they are buying it, we are also educating them about the prospects of having treatments. So this is some of the marketing strategies that we can implement here on the ground, and for which the only way to do it is with having all your 100% support to us. It's a new market. It's a high potential market. Taiwan spends a lot of money in tourism. Like almost 70% of the country travels overseas. They spend almost on an average $1,500 to upwards to up to $4,000-5,000 per trips. And the more we can push in the market, the more support we can give in the market, the more information we can throw in the market, the more road shows we can organize. I'm very sure that we will have a very good business coming in. Thank you.
Thank you, Shubhamji. Your earnest effort to promote Ayurveda in a new in a new country like Taiwan, where India is not that familiar. Is familiar, but your efforts, I am sure that it will be materialized very soon. And for your information, there are a lot of support from the Ayush Ministry. They formulated a immunity booster product. It's a mix of the herbs, and it is named as Ayush Path. It's a powder. It can be done like a herbal tea, which most of the manufacturers are following the guidelines Ayush department has given. It's an immunity booster. It is not a medicine. It is something like a mix of all the cinnamon, turmeric, all of those things are mixed together. And that's evolved during this COVID period. And, most of the households in Kerala or in India used their own preparation methods. And some people who are depending upon the shops, they used to buy it. So there is a lot of synergy which we can work together. And I'm not repeating the points elaborated by the panelists because it's all recorded. And we are running a little bit ahead of our schedule, but okay, we do have a lot of audience which is connected by YouTube also. And this side, I would like to congratulate FICCI. FICCI's Delhi office to have a joint meeting with the tourism as well as with the Ayush Ministry officials. This is very rare to get both these two departments to come and work together. And in the future, these two departments synergy in campaigning together, it will help the Ayurveda sector and the wellness tourism sector. I'm 100% sure. The efforts what we have done during the past 3-4 months is coming rewarded. And FICCI's new team, they have given responsibility for me to take over this FICCI Ayurveda Task Force as a chairman. We formulated a committee and we are very fast, and we do have a mix of people from all the states across in India. and our Manu Gupta and Abhilash is in the committee, so that we are working together. Our focus is to develop in the future the authenticity and the traditional values of Ayurveda. Manojji's point is very valid, and with all the points, I don't want to repeat because we are running short of time. So let us conclude the session. I thank all the panelists, right from Irina ji, Shubham, Manu, Swami, and Abhilash, to come and enlighten the points which the industry requires. And our synergy of working together will continue. And all our points and thought process will be taken into consideration, and FICCI will minute it, and it will be circulated, and it will be aired to the government, especially Irina ji's request on the External Affairs Ministry's visa issues and civil aviation. All these things, we will route through our respective committees, and this is the result of this particular webinar is only for that. So let us all hope. And before concluding, I just want to thank Dr. Jyotsna Suri and also Dilip Shenoy, the people who are behind the FICCI's activities, and also the prominent speakers. Today we were having Dr. Manoj Desri from the Ayush Ministry and Rubendra Bra from the Tourism Department. Anyway, thank you all. Thank you all for your valuable time and your inputs. Hope a better future for Ayurveda comes in the 2021. We are always positive. We think positive, we act positive, and we are going to face a good turnaround. That is what we expected. Thank you. Thank you very much.
Thank you very much, Rajiv. Thank you. Thank you, everyone. Thank you.
So we are concluding the session. Thank you once again for the people who visited us, people who were hearing us. Thank you once again. Bye.
Thank you.
Thank you very much.
Hope the next should
Thank
be
you.
the
Bye.
real offline meetings.
Bye.